Regulatory and compliance risks. Healthcare organizations operate within a complex regulatory environment, subject to various compliance requirements at local, state, and federal levels. These regulations cover a wide range of areas, including patient privacy and data security, quality of care standards, reimbursement policies, licensing and accreditation, workplace safety, and environmental regulations. Patient privacy and data security are crucial aspects of regulatory compliance in healthcare, particularly with the increasing reliance on electronic health records and digital technologies. Regulations like the Health Insurance Portability and Accountability Act (HIPAA) in the United States mandate strict controls over the use, storage, and disclosure of protected health information. Failure to comply with these regulations can result in significant fines, legal actions, and reputational damage. Quality of care standards are another critical area of regulatory compliance. Healthcare organizations must adhere to specific clinical guidelines, quality measures, and performance metrics established by various regulatory bodies and accreditation organizations. These standards are designed to ensure that patients receive safe, effective, and high-quality care. Non-compliance with quality standards can lead to penalties, loss of accreditation, and negative publicity. Reimbursement policies and billing practices are also subject to strict regulations. Healthcare organizations must follow the appropriate billing codes, documentation requirements, and payment models established by government programs and private insurers. Failure to comply with these regulations can lead to audits, payment denials, fines, and even charges of fraud or abuse. Licensing and accreditation requirements are another essential aspect of regulatory compliance. Healthcare organizations and professionals must maintain appropriate licenses and certifications to provide medical services. Regulatory bodies regularly review and update licensing requirements, and organizations must ensure that they comply with these changes. Workplace safety and environmental regulations are also critical for healthcare organizations. They must comply with rules established by agencies like the Occupational Safety and Health Administration (OSHA) to protect employees from workplace hazards and maintain a safe environment for both staff and patients. Non-compliance can result in fines, legal actions, and potential harm to staff and patients. In summary, healthcare organizations face numerous regulatory and compliance risks that can significantly impact their operations and financial performance. Effective compliance programs, ongoing staff education, and a culture of transparency and accountability can help organizations navigate this complex regulatory landscape and mitigate the associated risks. By proactively addressing regulatory and compliance challenges, healthcare organizations can maintain their reputation for quality and safeguard their ability to provide essential care services to their communities. Strategic risks. Strategic risks refer to the uncertainties and potential challenges that can affect a healthcare organization's long-term planning, decision-making, and overall competitive position in the market. These risks arise from various factors, including shifts in market dynamics, evolving consumer preferences, technological advancements, and changes in the competitive landscape. To remain competitive and ensure sustainability, healthcare organizations must proactively identify, assess, and manage these strategic risks. Market positioning is a critical aspect of strategic risks management. Healthcare organizations must continually assess their position in the market relative to competitors and adapt their strategies to maintain or improve their standing. This may involve identifying and targeting specific market segments, differentiating their services, or developing unique value propositions. As market dynamics change, organizations must be agile and responsive to ensure their continued success. Service offerings are another essential aspect of strategic risk management. Healthcare organizations must regularly review and adjust their services to meet the evolving needs of their patients and the market. This could involve expanding or contracting the scope of services, investing in new medical technologies, or specializing in specific areas of care. By regularly evaluating their service offerings, healthcare organizations can stay ahead of trends and better respond to consumer preferences. Partnerships and alliances play a significant role in managing strategic risks. By forging partnerships with other healthcare providers, technology companies, or research institutions, healthcare organizations can leverage the strengths and resources of their partners to improve their competitive position. Partnerships can help organizations access new markets, enhance service offerings, and promote innovation. Technological advancements and innovations can both create and mitigate strategic risks. While advances in medical technology, telehealth, and digital health can improve patient outcomes and enhance operational efficiency, they can also disrupt traditional healthcare models and create new challenges for organizations. To manage the risks associated with technological change, healthcare organizations must invest in research and development, adopt innovative solutions, and continually update their processes and infrastructure. Strategic risks are an inevitable aspect of operating in the healthcare industry. By proactively identifying and managing these risks, healthcare organizations can adapt to changes in the industry, consumer preferences, and technology, thereby maintaining their competitive position and ensuring long-term success. Effective strategic risk management requires ongoing analysis, innovation, and adaptability, as well as a commitment to delivering high-quality care that meets the needs of patients and the broader community. Quantitative risk assessment. Quantitative risk assessment is a systematic approach that uses historical data, statistical methods, and mathematical models to determine the likelihood and potential impact of various risks faced by healthcare organizations. By quantifying risks, organizations can better understand the exposure to different types of hazards, prioritize their risk mitigation efforts, and allocate resources more effectively. One of the key components of quantitative risk assessment is data collection and analysis. This involves gathering historical data on various risk factors such as patient safety incidents, financial fluctuations, and regulatory compliance issues. The data may be collected from internal sources such as electronic health records, financial statements, and incident reports, or from external sources such as industry databases, benchmarking studies, and government reports. Once the relevant data is collected, statistical techniques and mathematical models can be applied to analyze and quantify the risks. This may involve calculating probabilities, frequency distributions, and severity measures for each risk factor. The analysis may also incorporate scenario analysis, sensitivity analysis, and Monte Carlo simulations to account for uncertainties and potential changes in risk factors. The results of a quantitative risk assessment can be used to prioritize risks based on their potential impact and likelihood. This helps healthcare organizations focus their risk management efforts on the most significant risks and develop targeted mitigation strategies. By understanding the potential consequences of various risks, organizations can make more informed decisions about resource allocation and risk mitigation investments. Quantitative risk assessment can also support the development of risk models and decision-making tools. These models and tools can help healthcare organizations forecast potential risks, evaluate different risk mitigation strategies, and optimize their risk management processes. Additionally, they can be used to monitor and track risk exposure over time, allowing organizations to assess the effectiveness of their risk management efforts and make necessary adjustments. In conclusion, Quantitative risk assessment is a valuable tool for healthcare organizations seeking to better understand and manage their exposure to various risks. By using data-driven approaches and statistical techniques, organizations can quantify risks, prioritize their risk management efforts, and allocate resources more effectively. This can ultimately lead to improved patient outcomes, financial stability, and long-term success in a rapidly changing and complex healthcare environment.